So today's session is going to be on what to expect from your medical school interview. So a little bit about 6Med. So it was created by medical students for medical students, and we've taught a lot of students in the past 6 years. So if there's any specific support you guys want, maybe like things like interview support one-to-one, or you want to attend one of our 4-day courses, you can do as well. So the kind of events we do are these surgery webinars that we run every Sunday, 2 to 3 p.m. If you want to keep coming to those will be going on until the end of the year, so until the 11th of December. We also offer one-to-one UCAT and BMAT support. Usually that tends to, the one-to-one support runs throughout the year, but the long day courses, they run usually in the summer. Personal statement support, again, is one-to-one, and then interview preparation is one-to-one or in large groups as well. So a little bit about me. I'm a 4th year medical student at Bristol University. I just finished my intercalation last year in Imperial. I'm quite passionate about teaching, and I'm interested in surgery as well. So the main things we're going to cover today are just look at the general structure of interviews, how you should really be approaching them, and then trying to think through how we would approach common medicine interview questions, and looking at specifically current affair questions, because this is something that a lot of students struggle with, but it's something that's always asked about. And then finally looking at how you would approach ethical dilemmas, and how you would structure your answers for them. So that covers basically all the types, well, most of the types of questions they could potentially ask you at uni. It is a little bit of a whistle-stop tour because we only have an hour. So obviously try and make sure you look at other interview resources in your own time. And if you're thinking of going to interview courses, you'll learn a bit more there than you would here in a 1-hour session. But this is just to introduce you to all the different concepts. A little bit of the housekeeping, if you guys could just mute your mics during the session, and I'll try to make the session as interactive as possible. So when I ask questions, you can either type answers in the chat or unmute and talk. But because we're quite a big group, it's probably better if you guys type your answers in the chat box. You can also post your questions throughout the session in the Q&A chat function, and I'll either address them as and when we're going through the slides, or if it's more relevant to address it at the end, I'll do it at the Q&A session before we finish. So before we get started, on a scale of 1 to 4, how do you guys feel about medical interviews? So 1 being not confident at all and 4 being extremely confident. Where are you guys on that scale of 1, 2, 3 or 4? If you just want to put that in the chat. Alina, does this apply to dentistry too? It's mostly medical, but the questions are very similar. So why do you want to study medicine? You can just alter it to why do you want to study dentistry? The structures are still the same. The way they assess you is still the same. So it's probably relevant as well. So we've got a mix of, 1s, 2s or 3s. Okay, fine. Let's move on. So hopefully for people who are not feeling so confident, we can get you to either a 3 or 4 by the end of the session. So main aims are to firstly understand the basic structures of interview answers, and the structure will be the same regardless of what interview question you're being asked. So getting familiar with that structure is quite useful for you guys at this stage, so you'll be ready in time for interviews, and also to understand how to structure a good interview response. So the main purpose of an interview firstly is to try and sell yourself, and also to demonstrate why you deserve a seat at their medical school. Those are the 2 things you need to show. So you do need to kind of show off a little bit, but basically what you need to do is come across as confident as opposed to arrogant. And then the second one is obviously demonstrate to them what skills you have, which would make you a good doctor, which will obviously make them more likely to pick you over a different candidate. So the first question then, let me just move this out of the way. What can you use as a starting point for practicing interview questions? What do you guys think? Just type your answers in the chat box. Okay, lots of good answers coming in. So personal statement, question bank, previous interview questions, medical pillars, current news, GMC, practicing answering questions in the mirror. So yeah, lots of good suggestions there. The main one I was looking for was using your personal statement as a basis, because all the common questions they're going to ask you, like, why do you want to study medicine? What work experience have you done? What do you do in your free time? All of that is basically, you've already answered those questions in your personal statement. So using that as a basic structure of how you're going to verbally give your answers for the interviews for these types of questions is always useful. And looking at current affairs as well is quite good. So your personal statement, as I said, it's your best friend. So making sure to go through each of the paragraphs that you've already written and trying to help you structure your own answers for those common questions can be really a helpful sort of starting point. You might not end up using all the points you mentioned in your personal statement when you're verbally answering the question. You might add a few more things because you didn't have enough characters to add it in the personal statement. So it will change, but it's a good way to begin trying to figure out how you're actually going to tackle the interview stage. So looking at general structures for all interview questions, it's when they ask you a question, address that topic directly. So the last thing they want for you guys to do is to deviate from what they're trying to ask you. You need to make sure that you're answering the right question and you don't sort of go down a rabbit hole, which can be very easily done when you're under a lot of pressure and when you're quite nervous. Make sure to have lots of examples in your answers. Or what would actually be better advice is to pick one or two examples which you can talk about in quite a bit of depth, because really for these interview questions, they're looking for quality and not quantity. So they want to see that the experiences that you have, you've really reflected on it and understood the realities of a doctor, rather than just listing all the things you've done and not really showing that you have an insight into what you learned from that. So discuss key examples to back up the points that you've made in the first bit. And then what you need to do after you've discussed the example is try and extract some qualities of a good doctor from the example you've used. So for instance, say if you did work experience in the cardiology department in hospital, and from there you learned that the doctor had a really good consultation with the patient, where they used good communication skills to explain to the patient what heart failure meant. That shows that, you know, you need good communication skills. You need to also be able to explain difficult concepts in smaller chunks for the patient to understand. And also that helps you build your rapport between the doctor and the patient. So those are the key skills: communication and building that doctor-patient relationship. So those are the skills that you've extracted, and then you need to reflect on why those skills are important for medicine, which is the next point here. And then finally, what you need to do is always, with your answers, try and link back to how these skills that you've identified would make you a good future doctor. So how do you yourself, how have you developed your own communication skills, and why do you think this would make you a good doctor? So giving an example from whether it be you speaking to a patient, or you developing good communication skills by working in a team at school, or in your previous degree if you guys are graduate entries. So yeah, it's a mix of different things. So I'll tell you how to sort of structure the most common ones. So why do you wish to study medicine? Can everyone have a go at trying to maybe extract some points about what they would say for this answer? Don't have to be detailed, it's just some bullet points about how you would answer this question. I'll give you guys a few seconds. Okay, so you said interested in biology for a long time, like human biology, mixed between hang on, there's loads of answers coming in, mixed between caring role, scientific role, make a difference in the world, career that mixes both science and close contact with people. Okay, perfect. Good. Okay, so all of these answers are really good. What do you think can be improved with these answers? So I know it's like only bullet points, that you guys have said, but yes, exactly, that's what I was trying to get at. So they're all generic. It doesn't mean that it's a bad answer. You just need to not just say that. So you can't just say the reason why I want to study medicine is because I like biology and end there. You need to sort of say my initial reason for studying medicine was that I really enjoyed biology at school, particularly learning about human biology, the cardiovascular system, the respiratory system, and I just thought it was a really good way to put my knowledge into clinical practice. To then explore this, I did some work experience in this, and then give a specific example from your work experience. And then you need to reflect on qualities of a good doctor that you saw or developed in that work experience example. And then you need to link it back to why that would make you a good doctor again. So yeah, all your initial answers are good, but that's the initial reason which sparked your interest. But you need to also show, so that was when you were maybe in year 11, year 10, or when you were younger. But from then until now, what has continued to develop your interest? That's what you need to show in this answer. So for this question, why do you wish to study medicine? So I'm not going to do a 2-minute demo. I'm just going to teach you guys how you would actually explain the answer. So the main reason is it could be stuff like, you really enjoy the sciences, or you had a personal family experience, whether it be one of your parents or grandparents or like cousin or something who you saw in hospital who was quite ill, and you saw that the medical team worked really well to help your relative. And you can talk about it from there. Or it can be certain medical topics that sparked your interest. So one of the main ones at the moment would be stuff like COVID or, abortion after things that have happened in America. So you can talk about things like that and maybe say, you want to make a difference. And then that's why you went and explored it by doing things like work experience. So you can give your initial reason. And then what you need to do is talk about what did you do to find out more about it. So you can say, to explore this further, I did some work experience in GP, or I did some volunteering in a care home, or I did some volunteering XYZ, or I did some work experience in a, in a hospital, or I worked as a healthcare assistant, or you did some sort of role where you were communicating with the general public, basically. So you can talk about what did you do to find out more. It's likely better examples are ones which are like medical related. I know work experience has been a bit difficult to find, but try your best to use some medical related experiences. And then the third question you need to be answering within this main question is, how did these experiences confirm your interest in medicine? So what skills specifically, touched you, and what sort of skills did you think, oh, this is what I want to be doing for the rest of my life as a job? And then summarizing at the end and linking it back to, because these skills are so important and you'd be using it as part of your lifelong learning in medicine, I want to do this in the future, and try and link it back to why that would make you a good doctor, kind of thing. So the second type of the second most common question anyway, is why do you wish to study at X medical school? So that could be Sheffield or Exeter or Bristol or, Oxford, Cambridge, anywhere. But they'll ask you specifically, why do you want to study at their medical school? So how would you guys approach this question? Okay, like the course structure. Yeah, that's a good point. Make sure you're aware of what the course is offering, research the city, high standard of education, say their teaching style, that's a good one. Like the environment, the teaching style, the area. Okay, so all of you have talked about the course specifically, and you've talked about the area. What about the university itself? Student life, yeah, hobbies is the one I was looking for, because in a way, the second part of this, there's 3 different ways I would sort of structure this question. I'll go on to it actually, rather than rambling here. But, extracurricular societies, yeah, I think most of you touched on the main ones. So why do you wish to study at whatever medical school that you're applying to? So the first aspect of that question asks you to address why this medical school specifically. So as lots of you said, the course structure, so whether it's problem-based learning, case-based learning, or traditional. So problem-based and case-based learning is when you open a case or a problem, they give you a problem, the university, which is based on a patient and something they're coming in with. And they basically give you a scenario saying this 51-year-old patient came in with chest pain to the hospital. They have this is their medical history. What are you going to do next to find out what's going on? And then they take you through a case, and it's about 6-7 pages long, and like they ask you loads of questions which you have to answer throughout the case. And that's how PBL and CBL work. And you have to work in a team of about 10 to 11 students, or when you're in older years, it's usually 6 students, smaller groups. And you work together to figure out what's going on, and that usually helps your learning. You do have a facilitator, but they tend to take a backseat, and it's mostly the students leading and learning from each other. So that's what PBL is. So you'll open a case on Monday and then finish it the next week on Friday. So then you have enough time to research topics that people don't understand and come and teach each other at the end of the case as well on the Friday. So that's how PBL and CBL works. And then traditional is it's mostly lecture based with a few laboratory sessions. And yeah, so it's more you being talked at rather than actively learning. So some people prefer traditional, they learn better when it's lecture style. Some people learn better when they're actively doing something to try and think of how to solve the problem. So you need to decide which one's better for you. And you need to talk about that specifically in the medical schools, because they'll expect you to know what style they teach in. You also need to know how they teach anatomy. So do they do it via prosection or do they do it via dissection? So does anyone know the difference between the two? Yeah, Max, if you wanted to unmute. Or you don't have to, you can just type it in the chat. Surrounding hospitals, dissection, you do it yourself. Yeah. And then prosection is pre-dissected specimens, I think. Yeah, there's pros and cons to both of them. So with prosection, which is how Bristol does it, that's what I prefer doing, because I just know that if I were to do dissection, I'll probably, hit one of the nerves that you're supposed to preserve, and then you accidentally ruin the whole model and stuff like that. So you end up not actually seeing what you're supposed to be seeing because you've cut it out by accident. Prosection, they're already prepared, and most of your time you're spending trying to identify the structures and learning about how the anatomy itself looks, so that if you were to be asked a question, say when you're in an operating theatre watching a surgery, you would be able to confidently answer it because you've seen a lot of the sections. So you spend more of your time actually observing and identifying all the structures and learning that way. Some people are much more hands-on, so they prefer dissection, or if they are considering going into something like surgery, dissection is always a good start. So you could say, I'm more of a hands-on learner, and in the future I'm also considering surgery, so dissection is perfect for me, and that's what your university offers, which is why I'm applying to you. So that does make a big difference in terms of which universities people decide to go with. And then placements. So I think someone mentioned the surrounding hospitals. It does really make a big difference. So in first and second year, you might mostly be in your, just normal lecture halls in uni. Whereas in third, fourth and fifth year, you spend all of your time in clinical placement. So the problem with that is obviously your living situation and stuff like that will change. In Bristol, we get placed in Gloucester, Swindon, Yeovil, Taunton, what's the other two? Western, and then North Bristol and South Bristol. So North Bristol and South Bristol are the in placements, the remaining 5 are out placements, and you are about 1 hour, 2 hours away from central Bristol. So it does make a little bit of a big difference. So you need to see, are you more comfortable being around surrounding hospitals that are relatively close to you, or are you okay with going out? Because they will put you in a mix of both out and in placements unless you have extenuating circumstances. So thinking about placements, what they offer, and especially if you already know what kind of specialty you want to go into, I'm assuming most of you don't, but if some of you do, and you know that specific universities are linked to hospitals which teach that specialty really well, you might want to be tactical and apply there. But obviously most of you might not know, so it doesn't really matter that much, but it's just being aware that you have a mix of both out and in placements is useful, so that it doesn't come as a big shock when you actually start uni. And then intercalation, is that something you want to have a choice over, or are you happy to just do it or not do it? So some university courses are 5-year courses, and you have the choice between 3rd and 4th year to intercalate. So you can take an extra year intercalate, which means you'll be joining the year below after you do that intercalation. And then you'll finish your medical course a year later than other people in your year who didn't want to intercalate. So that's what Bristol is like. So it's a 5-year course. If you want to intercalate, you can opt in for it. Whereas places like Oxford, Cambridge, UCL, they're standard 6-year courses where you have to intercalate between your 2nd and 3rd year, or between your 3rd and 4th year. So it's all about thinking, do you want to have that choice, or do you just not want to do intercalation because you're not really that interested in research? So it's completely up to you. Hang on. Do any courses only use models? I should hope not. I'd prefer, obviously, actually seeing the specimens, the bodies which are donated to the hospitals and the universities. I feel like you would learn way better than just using models. I think you'd have to check that, because I'm not too sure. I think most universities do use actual specimens. What is intercalation? So it's a year where you take out of your medicine course, and you go and do a year of research. So you can do that either in the university that you've already done, or that you're already studying in, or you can do it at a different university, depending on how flexible your uni is. There are religious reasons for not choosing to dissect cadavers. Yeah, so obviously all of those things can affect your choice. Looking at learning styles, obviously when you're doing prosection, you don't actually have to touch the specimens. So yeah, it's up to you. You need to make that choice yourself. In terms of learning styles, so the next part of the question, how to answer basically why do you want to go to this medical school? After you've answered what the medical school structure is like, you then need to go on to talk about what your learning style is. Are you more of a visual learner, auditory learner, or do you prefer being quite hands-on? And maybe that impacts on what types of course structure you'd want to do. If you're a little bit more hands-on, you might prefer PBL, CBL, things like dissection and things like early clinical placement. Whereas if you're more sort of just a visual learner, you may prefer the traditional lecture-based courses and things like that. So you have to research a lot into the different types of uni courses. Also, the forms of assessment does affect which unis people decide to go to. So some universities do have a lot of weighting towards coursework and the things you need to get signed off during placement, like your practical skills, whereas other courses, other universities, their course is structured so that like 80% of your mark comes from your exams, like your written exams or your OSCEs, which are called practical exams basically at uni. And practical exams and written exams are always there. It's just the weighting on how much counts towards how much of your score will differ slightly. Again, as I said, the type of learner you are will impact on the medical school you apply to. And so you've talked about mainly the medical school itself, and then the final bit will be maybe discussing about the general life at the university. So it really might affect your decision whether it's a campus-based uni or whether it's not a campus-based uni. So campus-based meaning everything's in one place, whereas if it's a city university, the buildings may be scattered all over the city, and there is a central building, but there are also additional buildings just all over the city, with the general public being around there as well, rather than just having uni students. And I preferred having the buildings scattered and then having one main building as a city university, which is why I applied to Bristol. I just think when you're in a campus uni, everyone's just uni students and you don't really get to see the general life, which I didn't like, so that's why I applied to Bristol. And then you can also talk about what sort of clubs you might be interested in joining. So if you do play a certain musical instrument like guitar, maybe there's a guitar society which you might want to get involved in. Or if you play a certain sport like hockey or netball, they might have a club or something like that for you. And that's just to help you maintain your work-life balance and things like that. So someone said, how long do we have to respond to general questions like this? I feel like I'd be talking for quite a long time if I went into this much detail. It's more about practice. You'd have to learn to practice, because I found myself running over time as well. But you need to be able to pick out the most important points. So these are all the things you could possibly talk about. You might not have time to talk about everything, but this is the structure I followed for mine, and the structure that they use for the mark scheme as well. So it's all about being slick with it, and you sort of have to, you only get that with practice. So next question. So the next common question would be something like, what do you do in your spare time? So does anyone know how you would answer that question? What if the university has certain aspects I didn't like? I probably would just avoid talking about it, if I'm going to be completely honest, because surely it has a lot of aspects that you didn't like. You wouldn't put it as your top choice. It would be talking about the positives, because you are trying to sell yourself and you're also trying to persuade them to give you a seat. So I wouldn't necessarily talk about the negative bits. Okay, so lots of you have talked about different things, football, reading, and then link the skills back as well. Yeah. With this sort of question, you don't necessarily need to link it back to how these skills would make you a better doctor. I think in this one, they're just seeing whether you have been able to establish a good work-life balance, really. So yeah, you can do, if that feels natural to you in the answer, where you can talk about sort of linking the skills that you have back to medicine, but don't necessarily have to. The main thing they're testing you on is work-life balance. So pick a hobby, whether that be like playing a sport or playing a musical instrument. For me, it was the piano. And then I talked about how that helped me like develop manual dexterity, but also a bit of independence, and help me de-stress from things like not uni work, A levels, which is probably quite one of the most stressful years for me. And also how that helped me sort of establish that work-life balance and try and relax, which again will be useful when you come to do medicine, because it's a high stress job. So that's kind of what you need to talk about. I would say have about 2 to 3 examples, not just one. Good. So that one's an easy one, that question. When I practice questions from online, how do I know that my answers are good enough? Should I show people or find sample answers on Google? There might be sample answers on Google. It's just about like trying to follow this general structure that I'm showing here so that you're addressing everything. The main thing they're looking for in interviews is your ability to reflect. So always reflect throughout all your answers. So talk about, this is the skill I developed. I think this is really important because, and I also think this is important because it will help me when I come to be a doctor. That's what reflection is. How exactly do you stand out in the why do you wish to study medicine when you talk about your own specific work experience examples? If you just give generic answers and don't give any examples about how you, what motivated you to study medicine, then they're not going to score you highly. So it's about giving your specific examples, because your work experience will be unique to you. Okay, before I move on, does gaming count as a hobby? Yes, I've been asked this so many times. Yes, it does. It is something you do in your personal time. I think a lot of people find it a bit embarrassing to say it is, because in general, there's just that stereotype that it shouldn't be a hobby that you should be doing, because it's some people just think it's a waste of time. I don't. But I think a lot of people in the older generation think that. So I think it's still a good hobby because it helps develop manual dexterity, teamwork, communication, all of those things. And it's something to help you de-stress. And I don't want any of you guys lying or like hiding any of your hobbies just because you think it will be perceived in a bad way. You can still talk about it. Do they allocate you an actual score? Rachel, what do you mean by that? Like what aspect are you talking about? I'm not too sure what you're asking. If you just want to elaborate, and then I'll answer it. The remaining questions I will answer at the end. Do they allocate you an actual score? With each question they ask you, yes, they do. What hobbies is about gaming? That's what I was talking about. I was talking about Mohammed's question. I think any hobby is fine as long as it helps you de-stress and gives you a good work-life balance. Where can we read about current affairs? There's stuff on 6med websites. There's also stuff on the Medic portal, so have a look online. So current affairs structure. So there's a vast variety of current affairs they could ask you about. Can any of you name any of them? Does anyone know? Current affairs meaning what's currently going on in health / politics, because politics also impacts on health. Nurses strike, yes. Abortion, COVID. Monkeypox, yeah. Warfare, yeah. Strikes. Main strikes are quite in the news at the moment. Public health, aging population. Aging population has been an issue for a while, yes. Charlie Gard case, yeah. Vaccines. Underfunding of the NHS, yeah. NHS pharmacy supply issue chains, yeah. We also have blood shortage, so they might ask about that. Bed blocking, I wouldn't use the term bed blocking because it's seen as a negative term, but usually it's like lack of bed space is how I'd use it. Pay strike and Battersea case. Okay, we've got loads of things here, which is good. Okay, perfect. And Lucy Letby, yeah, that's a relatively new one, ongoing one anyway. So the structure I sort of follow for all of these is try and describe the medical or the public health problem that they ask you about. So this structure is quite generic at the moment, but I'll put it into practice in a second. And then describe what factors contributed to this problem. And there'll be several of them. So for example, let me do an example actually, so it's a bit easier for you guys to understand. A&E waiting times are really long. So that's has been an issue for a while. They did try to implement a 4.5 hour cutoff where patients who enter A&E must be seen and triaged and sent to the right specialty within 4.5 hours, but they haven't been able to meet that target. There have been lots of different factors contributing to this issue. So one of them is the fact that we have lots of staff shortages, so there's not enough people working in A&E to be able to, look at sort of treat the mass of people who are coming into A&E. So there's a disproportion in the number of staff to the number of patients, and a few things that have caused this include things like staff not being paid well. So a lot of them are moving to other countries, which has been happening for the past 5 to 6 years. Another thing is Brexit, which has really impacted on the number of staff that we have in the NHS in general. And also a lot of people who are medical students or nurses, student nurses, who then go on to become nurses and doctors, don't really want to work in A&E because there's not really much of an incentive to work there, because it's a high stress, not very well paid job with really unsociable hours. So I think one of the solutions could be to try and improve the way the A&E is run and also increase funding for this sector to try and help more people to be persuaded to go and work in that setting. Another thing that's contributing to this problem is we have an aging population. So a lot of elderly people are the ones who normally come into A&E. If they come in with a fall, for example, and they get into hospital, then they're staying in hospital for longer because they're elderly, which means they have more than one health problem. So we call that comorbidities, which then results in them staying for a longer time, because first of all, they take longer to recover. And second of all, if they come into hospital with one thing, they also tend to develop other things. So if they come in with a fall, and then in hospital, they develop a pneumonia, a chest infection, and then they need to be treated for 2 things rather than 1. And then if they stop, going to the toilet as often, they can become dehydrated and develop a kidney infection. So one thing can lead to another, and it's like a domino effect, basically, for elderly people. So they stay in for longer. And I think someone mentioned bed blocking. I wouldn't say bed blocking. I would just say because there's a lack of bed space and we have an aging population, we don't have enough beds to accommodate for other people who also need it when they come in through A&E, which means there's a lot of people staying in A&E and not being directed to the right place. So that's another thing as well. So that's how I'd sort of structure my answer. And then you can talk about offering solutions to the issue. So another issue is a lot of people who don't actually need to be in A&E just come to A&E for really small minor things. So one way to try and prevent that is to send out public health campaigns, like public health leaflets, and basically say, these are the kind of conditions you should be coming to A&E for. These are the conditions you should be speaking to your GP for. So by separating that, you're reducing the amount of people actually coming into A&E, which tries and helps reduce the burden in A&E. So those are the kind of solutions you should need to be offering. And you can also highlight any difficulties to those solutions. So it's not as easy as trying to increase the number of staff by persuading more people to come to A&E. It is sort of a long-term issue because we need to improve the structure of A&E it's in itself. So trying to acknowledge that some of your solutions may not be possible in a very short period of time is important as well, so that you're showing that you understand the realities of a doctor. And then just summarizing your answer. So you can say, so in summary, A&E waiting times are extremely long, and this is a current NHS issue. But as I mentioned, these are the solutions that can be offered to try and try and reduce this being as big of an issue. So that's kind of how I would structure my answer. Euthanasia, it's more of an ethical scenario rather than a current affairs. How would you ensure you've researched all possible current affairs? They may ask you about, what if you go into the interview and they ask you about a current affair that you know absolutely nothing about? Well, I think the most common current affairs you can be prepared for, and usually there are a list of them, which I'll go through in a second, but usually it's very unlikely they'll ask you something about something that you don't know anything about, because you would have either seen it in the news a little bit, or you would know about it quite in depth because you would have revised for it, basically. So these are the possible topics they can ask you about, and these are the most common questions they have asked in the past year, and they might ask this year because of all the things that have been going on politically. So they could ask you about COVID-19, how it's had an impact on mental health, especially lockdown and mental health. They could ask you about vaccination. When they ask you about vaccination, they also expect you to know how vaccinations work. So it tries to incorporate a little bit of your GCSE biology knowledge. They could ask you about antibiotics, more specifically antibiotic resistance. They could ask you about the effects of Brexit. So as I mentioned, A&E crisis, Brexit had a massive effect on it. A&E and GP crisis, so how they're being sort of overburdened with loads of patients and they're not able to cope. Abortion is a hot topic at the moment. Organ donation, opt-in versus opt-out system, and the aging population. So they can ask you about all of those. How does Brexit affect the NHS? Is it financially? It's not just financially, it's also a lot of people who were working here are no longer working here as a result of that. So it's also understaffing as well as underfunding. So I kind of just went through the demo, didn't I? The A&E crisis, so I'll move on. So yeah, the model answer, I may have missed a few things, so we can go over it here. So as I said, it initially had a 4-hour waiting limit, which hasn't been met. People are not being seen on time, which impacts on the quality of care. What are the contributing factors? As I mentioned, Brexit, COVID as well, which I didn't mention, but during COVID, A&E wasn't really able to cope because there were a lot of COVID patients plus other patients as well. So trying to isolate them, but also having enough space for people who don't have COVID was very difficult in hospital. We didn't have the equipment for that. Lack of bed space, I mentioned, understaffing and underfunding, which I mentioned, lack of patient education, I mentioned, and also slow discharge. So what I mean by slow discharge is that the people who were, so the elderly people who are coming in and they're staying for longer, some of them may need to go into care homes, and filling out that paperwork for them to be able to send to the right place, whether it's a care home or whether it's them going back home, but needing carers to come in, filling in that paperwork and trying to get that organised for some reason is just taking really long on the social care side. So that's also leading to slow discharge, which then means that those patients, even though they're well, they're still in hospital, which means that people who are unwell can't get into hospital. So there's problems with the discharge side as well as the people being admitted. And then the solutions that could possibly be offered: increase staff in A&E specialties, as I mentioned, public health campaigns to educate patients, and then improve the discharge procedure. Do they expect you to use stats? Not necessarily, but if you can remember one, feel free to use it. In terms of the way you would structure ethics questions, discuss the ethical issue they're talking about. So for example, if it was euthanasia, you would talk about what euthanasia is, maybe also describe how it's different to assisted dying. And then you would try and identify both sides of the argument. So what I mean by that is people for euthanasia, people against euthanasia. And the way you would do that is by incorporating the ethical pillars important for each side of the argument. So there, what I'm talking about is beneficence, non-maleficence, autonomy, and justice. So using that with your arguments, and then choosing which side you agree with and justify why. So a lot of students that I've interviewed before, they tend to so the question will be something like, do you agree with euthanasia? And people initially say the answer yes or no without discussing both sides of the argument first. And I think that does bring down your marks a lot. So what you need to be doing is just talk about describe the ethical issue in generically. Then you talk about the arguments for the ethical issue, arguments against, including the ethical pillars. Then decide whether you're for or against euthanasia, and justify why. With some of these ethical scenarios, because they're really complicated, you don't necessarily have to choose an answer. You can sit in the middle and say, well, it's quite a difficult concept, so there are good things to both sides of the argument, and then summarize your answer at the end. So as I said, the ethical pillars, so autonomy is the right to sort of be involved in your own treatment and be aware of what's going on healthcare wise. Beneficence is doing good, non-maleficence is doing no harm, and justice is fair and equal allocation of resources and treatment and stuff like that. Do you get marked down for sitting in the middle? No, but it depends on what type of question it is. If it was something like discuss euthanasia and the ethical issues involved, yes, you can sit on the fence with that one. If they're giving you a scenario where they say, there's one liver, and there are two people who are eligible for a transplant, and they give you some background information about both individuals, and they say you need to pick which one the liver goes to, then you would obviously need to give a definitive answer. So a few more things. So with confidentiality, the key things you guys need to know about. So these are the ethical concepts you need to know about. So you need to know the 4 pillars, as I just talked through. Then you need to know about confidentiality. So confidentiality is that patients should feel free to be able to disclose personal information and be reassured that it will be kept confidential because it's the law. And confidentiality can only be broken in 3 different situations. So if the patient is at risk to themselves, like self-harm or suicide, if the patient is at risk of harming close family members, or if the patient is at risk of harming the general public. So say, for example, if they have an infectious disease like COVID and they decide not to isolate and go out, and that's obviously a risk to more than one person because they could spread it. Or if they have HIV and they don't want to disclose it to their partner, that would be at risk of harming other close family members or their partner. So it's just thinking about that. And then the last concept that they would expect you to know about is informed consent and capacity. So a patient can only consent to treatment, so consent to saying yes or no to a treatment if they have capacity. And what capacity means is if a patient is able to understand, retain the information and repeat back that information that you've told them for long enough so that they can say yes or no to the treatment that we're offering them. So anyone over the age of 18 is assumed to have capacity unless they're not able to do any of these things. So understand, retain, repeat back, or give an answer to their treatment. If they're not able to do that, then they don't have capacity, and you would act in their best interest. But all people in general are assumed to have capacity if they're over the age of 18. Between 16 to 18 or under 16s are considered children, obviously. So it's a bit of a grey area. If they are assumed to have capacity, if you test them and they have capacity, then you can use the Fraser or the Gillick guidelines, the competence guidelines. And this is when young children who are under the age of 18, you have deemed that they have the capacity to consent to their own treatment. So a very common scenario would be something like a 15-year-old girl comes in to ask about contraceptives, and she is deemed to have capacity, and she understands the consequences of what she's doing, and she understands the pros and cons of treatment, and you're happy to give that to her without having to break confidentiality and tell her parents, because she has the maturity and she has the capacity to consent to her own treatment. So that's the only grey area. Sorry, could you go back to the slide for 1 minute? I'm guessing this one. Could you please send a copy of this PowerPoint after the call? I think you should all be able to access the recording anyway, at the end of the session. The one on ethical structure. Oh, sorry. There you go. No, don't worry. I'll just hang around in this one for a bit. If there's any Q&A questions, I can answer those. So, oh yeah, this is a good question. What's the difference between euthanasia and assisted dying? So euthanasia is actually giving an agent, like a drug, to kill the patient there and then. Assisted dying is, which is what assisted dying would, well, actually, yeah. So euthanasia is giving an active drug to help them die, which will be considered assisted dying, whereas palliative care is slightly different, where which is what's legal in this country, where we know that they're at their end of life and we can't really do anything for them. So say if they have cancer everywhere in their body and we can't do anything to help them, so they'll be considered terminal, they'll go into palliative care where you just manage their symptoms. So things like pain, nausea, vomiting, and what else? If they have secretions, so usually at the end of life you can't swallow properly, so you'll have a lot of mucus and stuff to clear those secretions and help you breathe. That will give medications for that, and we'll just help them be as comfortable as possible until their death. That's what palliative care is. Euthanasia and assisted dying sort of interchangeable, the same thing. So it's actively giving a drug which you know will kill the patient in the next few hours. So that's the difference, I'd say. How about withdrawing treatment? That's part of palliative care. As in you would withdraw treatment, which is going to help treat them, and instead you would switch it for treatment that only is managing the symptoms that come up throughout the day. So that's the difference. Okay, I'm gonna carry on. So the possible ethical dilemmas you could get asked about are things like pro-life versus pro-choice. You could also get asked about things like euthanasia or contraceptives for 16 to 18 years old, as I mentioned. You can also get asked things about organ donation, and a very common one is Jehovah's Witnesses and what sort of blood things you can give them. So you can't give them whole blood transfusions, but you can give them blood byproducts like, I think it's fresh frozen plasma you can give them. So there's certain, whole blood has lots of different cells in it. When it gets separated into different bits, you can give some of them, but you can't give the others. So have a look at that online for what Jehovah's Witnesses can receive. The other thing you can give them is synthetic blood transfusion, so blood made in the lab. So obviously that's not from another human, so it still respects Jehovah's Witnesses' wishes. So you would give them synthetic blood transfusions as well. So one of the, I think we went through this example, the contraceptive. So the main thing, so a 14-year-old girl comes in asking for contraceptives. What are the ethical dilemmas here? So this is a really common question. So we know a 14-year-old girl is underage, so she'll be considered a child. So things you need to consider, first of all, is there evidence of unprotected sex? Is there coercion in the relationship as well? So you need to speak to that patient and ask about what the nature of their relationship is like first, before you decide whether or not they require contraceptives. The ethical concepts you might discuss are things like Gillick competence. Do they have capacity to give consent to getting contraceptives? So the main ethical pillar here would be beneficence versus non-maleficence. So the beneficence is like, if you give her the contraceptive, then you know that she's having safe sex, and also she is, there's a lower risk of other issues like teenage pregnancy and things like that. Whereas non-maleficence, which is to do no harm, by not giving her the contraceptive, she could get in a lot more trouble, as I just mentioned. So trying to maintain beneficence versus non-maleficence can be useful. Looking at autonomy, so autonomy is the right to have a say in your own treatment. So we would be respecting this patient's autonomy if we are giving her contraceptives, so long as she has capacity, and confidentiality as well. So in which cases do you think this would be disclosed to parents or social services? Do any of you know? So in which case, in which scenario can we break confidentiality in this 14-year-old girl situation? Does anyone know? Yeah, exactly. I think most of you've got the right ideas. So if the girl's at risk, if there's signs of sexual assault, or if there's evidence of coercion, yeah, same. The coercion is basically another way of saying, like, a person who's forcing her to do things like that. But yeah, and then the solutions would be to try and first assess capacity to see if she actually has capacity to be able to consent to treatment like this, and make sure that there's nothing else going on, which is sinister. So those were the main things that I wanted to cover today. So now, on a scale of 1 to 4, how do you guys feel about medical interviews? And I will get to the Q&A, so don't worry. I will try and answer most of the questions. Perfect. Yeah, I think it'll be more practice, and obviously having a look through your own questions and maybe using the way I structured my questions here. So if we go back to this one, oh, hang on, where was it? Yeah, so here, if you try and organize your answers in bullet points like this with different ethical scenarios, like maybe euthanasia, if you talk about, obviously it would be structured slightly differently, it would be for and against, and then it would be ethical concepts and solutions and summary. If you try and do that with most of your answers and practice them under timed conditions, a lot of stations will probably be about 5 minutes or 4 minutes. It will vary from university to university to have a look at that. So just to summarize, make sure you structure your answers in a stepwise manner and take a few minutes to plan your main answers as well. And that was the end of the session, I think. So I'll try and answer questions now. I'm not sure if they gave me a feedback form for you guys to fill out, but let me just check. If they don't have one, then that's okay. I'm just going to check in case there was one. No, I think that's fine then. So if anyone has any questions, I'll be happy to answer them now. How long should you aim for an answer to be in a panel interview? About the same as a MMI, so like 5 minutes-ish. Let me go on to Q&A, because I think most of the questions are there. So what would you say is the hardest thing at interview? In MMI interviews, I think it's like, say if you did badly in one station, trying to forget that episode and like move on. So it's really important to try and do that, like forget that you had a bad station and just move on to the next station and try your best in the next set of stations. Because if you constantly keep thinking about the bad station that you've done, it's going to impact on all of the other stations. But if you try and forget about it and think, okay, that's only like 3 marks, I don't care about that, I'm going to try and maximize my marks in the next stations, you're more likely to do well overall. How much time should we be dedicating per interview roughly for practice? Maybe 2 weeks before, especially researching the uni and stuff. They do have very specific things on there that they would expect you to know about. So in Cardiff, they do a spiral course structure, and that's quite unique to Cardiff. So knowing that, especially if you have 4 interviews, hopefully most of you do, remembering 4 different course structures and things like that does take a while. So I'd leave about 2 weeks prep. Do you recommend us bullet point our answers to a lot of common questions? Yeah, bullet point them to start off with. Use them as your basic structure. Please don't write your entire answer out in a paragraph and try to memorize that, because that will just make you sound really robotic. But I would recommend bullet points so that you can have sort of a general idea of how you're going to phrase your answers. Does each uni have their own criteria assessed, and should we try and follow each of their criteria? They don't necessarily reveal their exact mark scheme, but the themes tested will be quite similar. So things like ethics, current NHS affairs, motivation to study medicine, knowledge of the medical school, they're all very common stations or themes which are tested across all unis. They might mark it slightly differently. They always give marks for saying, hello, my name is, introducing yourself at the start. They always give marks for, like, taking your time to answer the questions, planning it properly, and having good communication. You always get marks for that. So they're easy marks to remember. Will I be able to watch a recording after? Yes, you should be able to. How long would you get for each question? Depends on the uni. It's usually 1 minute of reading time and 5 minutes of answering the question, or 4 minutes of answering the question for MMIs. For panel, it will just be like a conversation with 3 interviewers. So the overall time will be about 30 minutes for the whole interview. Are you allowed to take a paper with notes on it into the interview? No. For current affairs, would they ask you about a particular case in general, mainly on euthanasia, but they ask about a particular case? It could be a specific case or it could be general. It depends on the year. Should we allow our personal views or our morals to influence the response we give in an interview? It could affect it if they're strong enough, like if you're pro-life, for example. Yeah, possibly. You can just say, because of my religious view, this is where I would stand, or my moral view, this is where I would stand. But you also need to be able to acknowledge the other side of the argument. I've been struggling with these kinds of questions. You're a surgeon in charge of assigning organs to transplant patients. 2 patients who need it. One is a 20-year-old homeless man who's a regular drug user. The other is a 40-year-old woman with 2 children who gets the heart. So you'd have to address both of them. So first I would say, well, the 20-year-old homeless man's a drug user. So he's younger. So if he does get the heart transplant, then he's more likely to survive with it for longer, but he's also a drug user, which means that that's going to have an effect on his heart, because regular drug users, it increases their risk of a condition called endocarditis, which affects your valves in your heart, and that means that that organ's obviously not going to last as long as we think it is. He's also homeless, so more likely to have increased risk of infections. And when you get a heart transplant, you're supposed to be immunocompromised, so that your immune system doesn't attack that transplanted heart. So he'll be more likely to get infections anyway. So is it a good quality of life? So you can talk about quality adjusted life years. So have a look at that online. So is it actually a good quality of life to give him a transplant, or should we manage him with something else in the meantime? And the 40-year-old woman with 2 children, she has dependents. So maybe the heart should go to her, because she's obviously might be the person working in that family, and she has 2 children depending on her. So it might be better off going to her. But at the same time, the main thing is, who has a better match? Is it the 20-year-old who has a better match in terms of like the the antigens presented on the surface of the heart? So are they a better match to the 20-year-old or 40-year-old? That would be the main thing to determine overall success and reduce the chance of rejection. But there are other things, like I said, to consider as well, and you would have to come to a decision. Doesn't matter which answer you say, whether you think it should go to the 20-year-old or the 40-year-old, as long as you're able to justify it. And the way you can justify it is using ethical pillars like autonomy, beneficence, non-maleficence, and justice. And then you'll be fine. If a university sent an email asking what I'm doing in my gap year, what are they wishing to find out? If you're doing extra work experience, and if you still are committed to studying medicine. Can doctors share their medical experience with other colleagues, or does that go against the Hippocratic Oath? You can share your medical experiences as long as you're not giving any patient confidential information. In this case, would we talk about Fraser guidelines instead of Gillick, as that's about sexual health? Yes. What is the new opt-in, opt-out law for organ transplantation? I think it's everyone is signed up for organ transplantation, and if you don't want it, you have to opt out. And that's how it was in Wales, but I think that's how it is here as well now, but just double check that in case I've got it wrong. Where can I access the recording? I don't really know. I think SixMed sends an email, or you might be able to, I know how to do it actually. You need to go onto the SixMed website, go back to, at the bottom of the website on the main page, it talks about the SixMed surgeries. And if you click on that, you should be able to access the previous recordings. Please, can you go back to the summary slide? Which one was that? Hang on. Yeah, there you go. Also, what do you do when they give you a question you have no idea on and you haven't planned for? Just try your best. It's similar to like if you ever get an exam question where you haven't really done much practice on it. Just try your best, show you're working out, so show your thought process. Also, do you commonly get scientific questions asking you about some A-level biology concepts? Yes. So vaccinations, antibiotic resistance are the main ones. They may ask you about like immunocompromise and like rejection of transplants and stuff. Vaccinations, they'll probably ask you about things like, or they'll expect you to talk about herd immunity. They won't necessarily directly ask you about it, but they'll expect you to talk about it. Top tips for us to do well on the day. Yeah, I'd probably say good sleep and have a good mindset. Also, reading your personal statement the night before can help. Do you mind me asking how your interviews were, how many you had, where? So I had interviews at Bristol, Cardiff and St George's. And the way I prepared was I'd spent about 2 weeks researching the university, 2 weeks before the date of the interview, preparing, researching. And I also the way I practiced, because I didn't like practicing with relatives, I just recorded myself on my computer answering the questions, and then I went back over those questions to see both my body language and also the structure of my answers, and I just kept improving on that, basically. Do you have any advice with acting scenarios? Struggle with bursting out laughing during these? Yeah, try your best to have a neutral face and take it seriously. Just think of them as like your friend coming to you and telling you about the problem they're telling you. The main thing they're looking at is communication and body language in this station. So just be empathetic and try and understand their point of view and try and see if you can help them solve whatever problem they're talking to you about. All my university choices have interviews on Teams, and I've been told they'll be more strict. In what way? Because I don't understand, is it body language or punctuality? I think it's more about like, because there's a higher risk of cheating, I think they will be quite sort of hard on people if they're like looking away too much or looking at the wall behind them, or like toilet breaks and things like that. I think they're a bit more harsh on people with that. So I think it'll be university specific though, so they'll give you a set of rules before the interview, so just have a read of that. And it will also be punctuality, but that's in any interview, you need to be punctual. And also like the way you dress, so you would dress the same way as you would if it was a real interview, like an in-person interview, I mean. Are there only ethical questions in the MMIs? No, it can also be in the panel. How much time do we have to think for an answer? It's 1 minute in an MMI. I don't know. I think you can take 30 to 40 seconds in a panel interview, but you have to remember you've got 3 interviews in front of you and just use it. It's more like a conversation. How does the reading time work? It's 1 minute for MMIs where everyone's silent and then they blow the whistle or the bell, whatever it is, and then you start the 5-minute interview. As an international student, in case they ask us questions like, why do you want to study in the UK? Do you think it's a good idea to also add you want to improve your English? Yeah, you can do. Or you can talk about like the healthcare system here compared to your country. What's the new opt-in, opt-out law? Again, yeah, I would check that again, because I'm not too sure, but I'm pretty sure it's opt-out, as in you have to opt. Everyone's said they have to donate all their organs, but you can opt out of it if you don't want to. How many MMI stations are there? It varies, usually 7 to 10. Is Gillick and Fraser competence the same? So Fraser is for things like contraceptives, and then Gillick is more sexual health. It's sort of interchangeable, because I think Fraser is the doctor and Gillick was the patient, and it's a law based on their names, made based on their names. So it can be used interchangeably, it doesn't really matter. Is it good to disclose that a topic is something you haven't looked at in detail when answering a question? No, because it just shows a little bit of underconfidence when you start your answer with, I'm not too sure, but I would just say, well, in this situation, and then talk through the answer. You do have to act a little bit confident in interviews. Are the MMI stations in one big room? Yes. Can other candidates hear your answers in MMI? No, because there's so many people talking at the same time, and I don't necessarily think it's loud enough for it to interrupt you. I thought the same thing, but it doesn't affect you, to be honest. But yeah, if that's so there's more questions here. Are there any ethical questions? No, I'm on to that one. Is there a difference in the questions they ask versus in panel versus MMI? Not really. They might do a few more problem solving things in panel, where they ask you to talk through a problem with the interviewers. And in Imperial and UCL, they usually bring up your BMAT essay as well. So just having an idea of what you wrote there is good. How would you answer the question about the transplanted 2 patients were compatible? Oh, I think I went through that. Immunosuppressants, yeah. I didn't say immunotranquilizer, I said immunosuppressants. And yeah, those are all the questions. So if everyone's happy, you can go. How many MMIs are problem solving? I couldn't answer that question. It changes with every uni and with every year. If we use a teamwork skill in our personal statement, is it better to talk? No, you can talk about that in your personal statement, in your interview. And not a lot of interviewers actually read through your personal statement. It's more the admissions people, not the actual interviewers. But yeah. Please, can you give an example of a problem-solving question? They might say you're working in a team and you have a problem with one student. How would you solve this problem? That kind of thing, but have a look online. Are there stations that require procedures? No. Like cannulations and catheterizations, I don't think a lot of students applying for medicine would know how to do any of that. So no, that's more like medical school exams. That's it. Thanks everyone for being quite interactive as well. Hopefully you'll be able to access the recording on the 6med website, so have a look there, but if you can't find it, just message on the WhatsApp chat and hopefully someone can help you with it.